Good evening. We will now call the Finance Committee meeting to order for November the 16th, 2020. Item number 1.
Consider approval of Finance Committee minutes of November 2nd, 2020.
Is there any discussion?
Move for approval.
Second.
We have a motion and a second. Roll call.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds. Jamie Stout.
Yes.
Ivory Van.
Yes.
Mayor Marlon Coleman.
Yes.
The motion passes. Item number 2.
Consider approval of claims for all city departments October 24th, 2020 through November 6th, 2020.
The Purchasing Committee was unable to meet due to not meeting quorum. And so we have the motion of the committee.
Move for approval.
Second.
We have a motion and a second. Roll call, please.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Mayor Marlon Coleman.
Yes.
And the motion passes. Item number 3.
Consider approval to accept the fiscal year 2018-2019 audit performed by Arledge and Associates or take other necessary action.
Ms. Kingston. Is she?
Yes, LaDonna Sinning and Jeremy Johnson are joining us remotely to present the 2019 audit.
Hi, Jean. And
Hi.
everyone else. This is LaDonna Sinning. I'm a partner here with Arledge and Associates, and we are happy to get to present this to you tonight. We know it's a long ways out from when you wanted it, but I think you have a good product and overall some good news. I'm going to let Jeremy speak to your audit a little more specifically for just a couple of minutes. When he's done then, should you have any questions, we're happy to answer them. Jeremy?
Okay, can everybody hear me?
Yes.
Yes.
Okay, so I'm going to do kind of the quick and dirty version here, just running through the basics. The first couple of pages are the opinion, which is what, actually the first couple of pages are MD&A, but if you scroll down a few more pages, you'll see the opinion, which is an unqualified opinion or a clean opinion. So that means everything is materially correct as far as what we could find. We did have a couple of findings toward the back of the report. You should see those on page, bear with me here. On page 84 there, and if you have any questions about those, I'm happy to answer them, but really kind of the nitty-gritty of it is we had a clean opinion. As you all know, we had some difficulties this year with COVID, and pretty much 2020 was quite a year, so we know that going forward we're not going to have those difficulties, and project that in the future years we should be able to get this in a much more timely fashion. So with that, if you guys have any questions, I'm happy to answer them.
So Jeremy, thank you. This is Mike Miller. We do appreciate the work you've done and meeting the challenges that we've had, and we are excited to get, like you said, the clean audit opinion, and I know you're available for any questions from the council.
We are, and that's questions in the future as well, folks. If you have a question tomorrow, we're still available to answer it.
Staff does recommend approval.
Do we have a motion?
Move for approval.
We have a motion. Do we have a second?
Second.
We have a second. Motion and a second. Roll call, please.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Mayor Marlon Coleman.
Yes.
And that motion passes. Item number 4.
Receive report and recognition for City Council and Council appointees diversity training.
Yes, Mr. Cutler wanted to speak on this item, and he was unable to be here this evening, so I would like to move this item to next week's agenda on 11/23. We need a motion in a second to.
So with that, you're talking about moving it forward to City Council with that recommendation?
Yes.
So moved.
Second.
We have a motion and a second. Roll call.
Tracy Hous,
Yes.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Jamie Stout,
Yes.
Ivory Van,
Yes.
Mayor Marlon Coleman.
Yes.
And the motion passes, and that concludes our finance meeting this evening.
Okay, I would like to call into order the Public Works meeting for November 16th of 2020. Item number 1, please.
Consider approval of Public Works Committee minutes of November 2nd, 2020.
We all had time to review the minutes. Is there any discussion or a motion?
Move for approval.
Second. Roll call.
Tracy Hous,
Yes.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Jamie Stout,
Yes.
Ivory Van,
Yes.
Mayor Marlon Coleman.
Yes.
And the item passes. Item number 2.
Consider approval of amendment number 2 to engineering services agreement for Project C Interconnect Water Lines with Cowan Group Engineering, or take other necessary action.
Mike Stewart.
Mr. Chair, Stephen Morton will address if you will allow it.
Yes, I will.
Thank you.
Good evening. This item is actually for our interconnects of our new 30-inch water line, and if you'd be so kind as to indulge, I do have some handouts for committee.
Yes. Yes, I did.
Oh, yes, but thank you.
Thank you.
If you've got extras, thank you.
Okay. This project is so big that we broke the interconnects up into 2 packages for better bidding prices on this. As you can see, the kind of teal line, which will be on page number 2, that is our new 30-inch water line. The red line indicates package B, which has already gone through council for approval and is currently in the design phase. And package C is the one that we are voting on tonight. And this should complete all the interconnects to that 30-inch water line, thereby disconnecting the aged, very antiquated 24-inch water lines. We have 2 of them running through the city, and those are in excess of 100 years old. So it is time to replace those. The addition of the 30-inch water line is also the next step. These interconnects are the next step, I should say, in improving our water quality moving forward. And I'll be happy to answer any questions, and staff does recommend approval.
Okay, is there any discussion from the council or a motion?
When will they connect?
The timeline is roughly about a year, year and a half to have everything connected.
Great job, staff. I move for approval.
Second.
Okay, roll call.
Tracy Hous,
Yes.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Jamie Stout,
Yes.
Ivory Van,
Yes.
Mayor Marlon Coleman.
Yes.
And the item passes. Item number 3, please.
Receive report and discuss Veterans Day activities in Muskogee.
Mayor Marlon Coleman.
Let me say good evening to my colleagues on tonight. We had a wonderful weekend this past week celebrating the lives of our veterans, both present and past, those who have served and are alive to talk about it, as well as those who are no longer with us. It has been often quoted that when we think about our veterans, they gave up 2 lives, the ones they had and the ones that they would have had. Yet they were happy to serve to protect us and our freedoms. I am fortunate, as are many people here tonight, to have many relatives who have served in different capacities in the armed services. 2 of my great uncles served in the Korean War. Several of my uncles served in Vietnam, and I've had several cousins and relatives that served in the Afghanistan and Iraq wars. And certainly, we paused to recognize all of those men and women The day that we recognized them, there were several women veterans there, and I think that was a strong testament to our democracy that people of all colors and genders have fought to defend our freedoms. And so I'm going to show us a few slides that we had the opportunity to photo with our veterans on last week. They were a very excited bunch. We could not have the Veterans Day parade as we normally would have, but the veterans did show up in strong numbers. They were there to be recognized, and it was a reminder to me that Muskogee has a large veteran population. We have many men and women, veterans, who live by choice here in the city of Muskogee. I had the opportunity to visit with one of those gentlemen, and I asked him, was he here simply because of the VA hospital system? He said, no, I'm here because Muskogee has proven itself to be friendly to him, as well as the future veterans here in Muskogee. And so we gave our commitment to them that we would do everything we could to be certain that Muskogee stays that way, that we are able to coordinate with our Veterans Health Administration, the possibility of partnering to have housing for our veterans. It is federal law that many don't know that no veteran should be denied housing. No veteran should be denied housing. The problem that we run into with our state of housing is that even though that may be federal law, we have an obligation to be certain that those men and women have a roof over their head, that they have the housing that the law actually provides for. Many of us tonight enjoy the luxuries of having a roof over our head. We enjoy the luxury of running water, heat in the winter, cool air in the summer. But many of our veterans, for many reasons, some traumatic, even though they have the opportunity to take advantage of those possibilities, they don't. And so we want to be in a situation as not just good Muskogeans, but as good Americans, to be certain that we partner with our veterans organizations and do what we can to celebrate them. Jerry McPeak was brave enough to take a photo with me, as well as the other lady who coordinated many of the activities. It was a festive day in spite of the circumstances. Some of the veterans even commented that they preferred getting the individual attention versus the parade. That doesn't mean that we will rule out any future possibilities of a parade. But I think in addition to what we do on Veterans Day, we need to be mindful of the fact that every time we celebrate our freedoms, every day should be Veterans Day. Every day should be an opportunity for us to serve and celebrate those men and women. Muskogee High School Band was present, and they did a wonderful job playing and participating by handing out awards, emblems, medals, tokens of appreciation to our veterans. And let me say that the tokens they received may not have been much in terms of a monetary value, but it made their day. It made them feel special. This was one of the first major events held at the Depot Greens, and I think that it was an appropriate occasion that we did it there, because we're able to enjoy places like the Depot Greens because of our veterans, because they served, because they defended our democracy, and many of them continue to serve. And so we just wanted to report that as our good news item for the week, to recognize those men and women, to celebrate them, and to remind us as a city to remember that we have a large veterans population, that those people could live anywhere they want, but they choose to live here in the city of Muskogee. So join me in celebrating our veterans one more time on tonight.
Thank you for that, Mayor. Really do appreciate it. Any council discussion? Okay, there's no action to be taken on this item. No one is here to speak, so that concludes our meeting.
We'll now call to order the special call meeting for the Muskogee City Council for November 16, 2020. Item number one. Roll call.
Mayor Marlon Coleman.
Here.
Deputy Mayor Derek Reed. Ivory Van.
Here.
Jamie Stout.
Here.
Evelyn Hibbs. Alex Reynolds. Stephanie Morgan.
Here.
Tracy McGee.
Here.
Tracy Hoos.
Here.
We are accounted for. Item number one.
receive report on the COVID-19 pandemic in Muskogee, and if necessary, take appropriate action to authorize and approve a subsequent amendment to Resolution Number 2801, declaring a local emergency, or City-County Joint Resolution Number 2803.
We will hear from Mr. Miller. Then we have several individuals that have signed up to speak to this item. When they are done speaking, I will give my brief remarks and then call upon the council to make any remarks and considerations at that time. Mr. Miller.
Thank you, Mayor, members of council. We're all aware of the topic of the day, the week, and really of the year with COVID-19. We've seen our numbers continue to go higher, much, much higher than they have been in the past. And that's having an effect on how we do business as a city and how people do business in our city and how they are living their lives. Our kids, my daughter's at Muskogee High School, they're on virtual this week, and they weren't planning to be, but now they are. So we know the effects that it's having. One of the effects it's having that I'm going to ask Mr. Tucker to address is how we conduct our meetings. We had a state law change that allowed for virtual meetings and virtual attendance by council members up through November 15th, which was yesterday, and the law expired. So now we have to be here in person or possibly do video conferencing. Mr. Tucker will explain those very kind of narrow circumstances under which we can do that. Again, how COVID-19 is really affecting everything that we do. Mr. Tucker, would you please address that?
Absolutely. Thank you, Mr. Miller, Mayor, members of the council. As Mr. Miller said, we had a legislative amendment to the Open Meeting Act to allow us to meet virtually via telephone and video conference, and that has since expired as of November 15th. So with that, the legislature has determined not to make those amendments permanent, at least in the absence of their legislative session, which will begin in February. And so what we're left now with are provisions within the existing Open Meeting Act, which allow video conferencing in limited circumstances. And so I wanted to talk kind of very briefly as to what those circumstances are. So under the old law, or under the amended law, video conferencing and teleconferencing could be entirely remote, meaning none of the council was required to be at a physical location. Under the current law, now that the amendment has expired, only less than a majority of the members of council can appear via video conference. So telephone conferencing is completely out. It is only video conferencing. And so the members of the council who appear remotely must be able to see those present in the chambers and hear them. So sight and sound must go both directions for video conferencing to be permissible. Secondly, the meeting notice has to indicate which members of the body are going to be appearing remotely. The location must be identified on the agenda, as well as the address and the phone number of the video conferencing site. The video conferencing site must be from within a location within the city, and so there's no other restriction. For example, if Councilor Van appeared via video conference, he wouldn't have to call from a location within Ward 3, as long as it's anywhere within the city. The compliance with this provision is met. The location itself must be open to the public. And so in these instances, if we have members who do want to appear via remote for whatever reason, then it, of course, is advisable that it be in a location where members of the public are permitted to enter and not have it at someone's home. Next, if the council elects to allow any members to appear via video conference, then the members of the public who also wish to appear via video must be allowed to participate in that regard as well. And then finally, one of the big challenges is under the amended law, which is now expired, executive sessions could occur via remote, via video or teleconferencing. Now those are completely prohibited under video conference and must be in person. So any executive sessions from this point forward do have to be in person. Now, if we have a council member who is appearing remotely, and there is an agenda item for them to appear, an agenda item for an executive session, then effectively that council member appearing remotely would be absent and not be able to participate in the executive session should one be on a particular agenda. So with that, I'm happy to answer any questions, but that is kind of the state of the law right now. Governor Stitt referenced that at his press conference last week and indicated that it was very likely that cities and towns and other agencies would have to continue meeting in person until the legislature came back in session in February and took this matter up to determine if they wanted to make further amendments or to extend those that have already expired. So with that, I'm happy to answer any questions.
Mr. Tucker, you said if the council should allow video conferencing, do we need to take it up as a motion to allow it, or?
It would be, I would say not necessarily allow it. I meant that more in the generic term.
Okay.
If we have individual members who need to appear remotely, then as staff, all we'll need to do is make sure that we've got the proper recording and presenting equipment, and to make sure that only less than a majority appear remotely. So a majority of the council still has to appear in chambers.
Mr. Miller, will we have that equipment accessible by next Monday?
We are looking into that. We're going to know before we publish the next agenda. There's a couple of hurdles. I've talked with our technical staff in the back even tonight. A couple of hurdles. One is making sure, as Mr. Tucker said, that everyone, every member of the body can see and hear one another. And then number two, making that the same for each citizen who wishes to participate in that way as well. And so that second one is a little bit of a curveball because we got to make sure that we're having our meetings done in a decorous fashion, and so that the right people can talk and the right video is shown. It's a possibility, but we'll try and we will try and sort that out before our next agendas go out and make every attempt to try and conquer those hurdles. But I can't guarantee you that we will be able to given that time frame.
I think most of us will agree that we'd like that capacity, even if we have to contract it out.
Understood. We'll definitely be using, as we do now, some third-party contracting software, and so we'll look at all the resources. We'll be able to use the resources within the budget that we have to make that happen. But it's just a matter of being able to do it in a timely fashion before we get the next agendas published.
So one other thing I would add is since we do post the agendas, generally they're submitted on Thursday prior to the Monday meeting. Any council member who needs to appear or who desires to appear via remote should probably let either Mr. Miller, myself, or the clerk, Tammy Tracy, know prior to that, and the location from where the individual will be calling, just so that we have that information for when the agenda is published. Because if that information does not appear on the agenda, then a remote appearance cannot occur, because it does have to appear on the agenda.
And the remote, you said this previously, but I just want to make sure I understood. The remote location has to be accessible to the public as well.
That's correct.
So, okay. Thank you for that, Mr. Tucker. I know we'll have more from you on this agenda item later on. As you guys are well aware, I'd like to ask Tyler Evans to come forward and give us an idea about the state of things here in Muskogee. But as you are probably aware, Governor Kevin Stitt made an announcement earlier today of 3 new executive orders. Before the meeting, I could not quite find those orders, but we heard the announcement of them, and we hope to get a copy of them soon. Tyler, you're nodding your head like we have them now? Okay, but the main issues that were raised were mandatory spacing of tables 6 feet apart in restaurants, mandatory nightly closure of restaurants and bars by 11, and mandatory mask wearing for state employees. So as we're taking in the situation that Mr. Evans is going to outline for us, we know that the state has given us further guidance, and we can consider that as part of this agenda item as well.
Thank you, Mr. Miller. Good afternoon, Mayor, members of council. That is correct. I I was able to find those three that Mr. Miller mentioned. I haven't found them on the state's website yet as an executive order. Once we do, we can provide those to you. But as stated by Mr. Miller, starting Thursday, those three items take place, such as restaurants having to keep tables 6 feet apart, or they can also install a protective barrier to keep COVID from spreading from one booth to another, and that restaurants and bars also close at 11 p.m. at night. However, they can still do curbside and takeout service. In front of you, you should have your packet that you're used to seeing. Today, for the city of Muskogee, there's 398 active cases of COVID in city limits. That's up 80 from last week, up 176 from 2 weeks ago, and from about 2 months ago, September 14th, we show on the table there, we're at up 268. There at the timeline there at the bottom, the line graph, you can see starting about October 19th is when we kind of start going up in their number of active cases, and we've had a sharp increase since November 2nd in the number of active cases in the city limits of Muskogee. The state of Oklahoma is showing that we're currently at 79 cases per 100,000. That was as of last Thursday when they do the weekly report on the COVID tracker system. Concerning the ICU bed availability, we're currently at 6% ICU bed availability for the state of Oklahoma. We were also at 6% last week also, so we're holding steady there. The Oklahoma COVID-19 weekly report that comes from the weekly epidemiology and surveillance report, it's November 6th through the 12th is when this report was in regards to, they said that 16,919 cases were reported in the past week, and that it was a 74, almost 75% increase from the week before. So the last couple of weeks have been an unfortunate, hard-hit active cases in our community. On the following page is the percent positive with the 7-day rolling average. As you can see, about October 20th is really when that trend line starts increasing. The daily is signified there in the blue dots, and the red being the trend line or the average. That continues to increase. The cases and deaths, as you see the blue chart with the blue trend line, we've got a sharp increase there from about November 7th. Sharp increase upwards for the number of positive cases. On the following page is the percent of cases ever hospitalized. That seems to be staying about steady over the past 2 months. However, the number of emergency department visits related to COVID-19 symptoms tend to increase, and it looks like it's been going up since about September 16th. On the following pages is a COVID-19 report from the Washington Task Force, their recommendations. Unfortunately, the metro area for Muskogee and Muskogee County is back in the red zone according to the Washington Task Force. That concludes my update in regards to this packet here. We do have Doug Walton from Muskogee County Health Department on the line with us. Doug?
Thank you, Tyler, Mayor, and Council. The numbers that Tyler has shared, the county increase in cases is following a very similar trend, continuing to increase by a growing daily rate, and we continue to do testing at the Muskogee County Health Department, and we'll continue that into the foreseeable future, Monday through Thursday, 8:30 to 10:30 a.m. and then Fridays free flu shots, 8:30 to 4:30 p.m. No appointments needed, and it's just a curbside call upon arrival, and nurses will come out to assist. I did share last week a little bit of information. Just wanted to touch on that again briefly regarding both the evidence for the communities that have adopted face covering mandates and those that haven't, and the reduction in the spread of COVID in those communities being substantially greater than in those without the mandatory face coverings. One thing I didn't really talk about last time and should have was just really reminding council members and the viewers and listeners really about sort of the nature of COVID and why it is that the masks are so important. COVID-19 spreads mainly from person to person through respiratory droplets. And these droplets travel into the air when we cough or sneeze or talk or shout or sing. And then these droplets can land in the mouths or noses of people who are nearby. Or they may breathe in these droplets. And so face coverings are just a simple barrier to help prevent respiratory droplets from reaching others, and by reducing the spray of those droplets when worn over the nose and mouth. It's important to wear the face covering even if you do not feel sick, because we know that it's possible to have the COVID-19 virus and never develop symptoms, asymptomatic. It's estimated that approximately 60% of the spread of COVID is by people who are asymptomatic, who don't have symptoms. And therefore, wearing a face covering prevents us from spreading those droplets if we don't know we're sick. The evidence is also mounting to suggest that the face coverings also provide protection for those wearing the coverings from those who may be sick as well, for the same basic reasons, that they reduce the chances of those droplets entering our mouths or noses. I do know there has been some suggestion that level of effectiveness might not be as high as it could be, or as high as others say, but honestly, even if it was only as little as 1 or 2% effective in the city of Muskogee, then we'd be talking about 370 some odd additional cases that would happen at a 1% rate. And it's actually estimated to be much greater than that in its effectiveness. So just wanted to kind of relay some of that information, and would be happy to take any questions from the council.
Mr. Mayor, are we recognized?
Yes.
Doug, that was a wonderful and that was a great report. And thank you so much for sharing that with us, because we know that for a long time up here, that this is happening. Today I drove around Muskogee, went to the urgent care, both urgent cares, one on 32nd Street and also the one out there on Shawnee. Lines of people. I have never seen nothing like it. This weekend, I had to go to the hospital and take a lady that I take care of to the hospital. We got there at 2 o'clock. She took a COVID test at 3 o'clock. It takes her 1 hour to get the results. She didn't have it. She was negative. But she didn't go there for that. She went there for just a medical problem. Well, stayed at that hospital from 2 o'clock to 7:10. She had to go. They didn't have no room in the end at the Muskogee at the St. Francis Hospital. Just so happened, God opened the door, there was one room left in Tulsa, Oklahoma. And we took her to Tulsa, the ambulance took her to Tulsa, Oklahoma. The ambulance left at 5:30. I'm sorry, we called the ambulance at 5:30. The ambulance didn't get to the hospital till 7:10. That's what I'm saying. We have said this months ago. Months ago. We tried to get you to mandate having masks here in our city of Muskogee, but you said no. And you kept saying no. So when I was sitting there talking to the doctors and talking to the nurses, they're tired. They really are. When I say tired, they're tired. But you just had to be there and be in my shoes and watching this lady hurt it was just saddening. My heart still hurts because, like I said, we warned you, but you didn't listen. I said I wasn't going to say nothing tonight, but I couldn't help myself because God knows that's the truth. I said it a many times up here. I went to 4 meetings up here trying to get this mask mandate passed, but you kept saying no. But one thing about it, God's got your attention now because Muskogee, we're in trouble. Just like G.T. Bynum said, most of the people are coming from other areas. That lady Saturday night came from Muskogee to go all the way to Tulsa to St. John. So I hope we awoke. I hope we kind of got a little awakening up in ourselves now because it's late in the evening. And I'm sorry that y'all didn't listen. It's a shame, but we're in trouble. I'll turn the floor back over to you, Mr. Mayor.
Thank you. Do you have any other questions for Mr. Walton?
Mr. Mayor, can I be recognized?
Yes, ma'am.
A couple things, Doug. In your report, you're stressing the mandate of masks, but the reason why a mask is important in the use of the mask, and I appreciate you explaining that. I also noticed that Just Done Correctional Center in Taft, Oklahoma, numbers are up high. No one has mentioned it in the report. Can y'all touch on that?
That is correct. They are showing a pretty significant increase in positive cases within the facility. I really don't have more to report on that. 274 current positive cases in Just Done.
My next question is, do we have a plan of action to the emergency manager and to Doug Walton if we had a breakout? Are we prepared?
Our plan, since Muskogee County Health Department, the health department takes the lead in this pandemic, our direction for assisting them would come from them. But as far as you're concerned, if you're talking about mass immunizations or mass vaccines, we have those plans already. That's been in place. The Boo and the Flu, if you remember, we did a couple of weeks ago. That's in preparation for something like this that we've had for years. But like I said, Doug and I talk almost on a daily basis, if not a couple of times a day. So our direction from the city for emergency management would also be teamed up with Muskogee County Emergency Management and would fall under the lead of Muskogee County Health Department or the Regional Medical Response System, the RMRS, on what we need to do if a plan is implemented, either statewide or countywide by the health department.
Doug, do you got a plan out there?
Well, I would just add that the response to an extreme outbreak would really be a matter of slowing activity as much as possible beyond the recommendations that have already been made repeatedly for people to social distance and to avoid gatherings whenever possible. And that order for slowing of business would have to come from this body, actually. And that's a decision that the council has made in the past and may have to make again in terms of, maybe what would be called shutting things down. But that's the way to respond. That's the way other cities have responded and are responding currently, is by reverting back to basically a reduction in social activity and requiring that.
Thank you, Doug. One more question and I'm done. In the testing, what is the percentage when you test them that's coming up positive now? Are those numbers increased as well?
They have been increasing, yes, ma'am. They are averaging now in the 13 to 18% range for our testing at the health department. They were as low as less than 1% of people tested were positive early on, up until really about June. And then they began climbing steadily from that to pretty quickly into the 5-10% range, and now much closer to 15% positive.
Thank you.
Also an indication of community spread. Yes, ma'am.
I have one more question for Doug. You still there, Doug?
Yes, sir.
I was just curious, y'all's hours are on from Monday to Thursday from 8:30 to 10:30 on your testing?
Yes, sir. That's when we're conducting the testing.
I was just wondering, any possibility that we could go longer than that to save all these lines in this urgent care? Because that urgent care is $100-some test. Y'all are free. What process would we have to do to get y'all to stay open longer, to do more testing for the citizens that can't afford $100-some test?
Right. Unfortunately, right now, we're faced with staffing issues at the health department, and those really are preventing us from doing more testing while still providing the other essential services, immunizations, and other clinic services that we provide. And without additional staffing, very unlikely that we'll be able to do much more testing, but we are able to test most everyone who does come for testing during those times, and we'll continue to do that.
Whatever happened to the mobile test thing up in Bixby? I'm sorry. Whatever happened to that? Because they would go around and test people also. You know, I asked you about it one time. We met them at the Civic Center. You remember that?
Yes, I do. I do remember that, and that was the antibody testing. Mm-hmm. And I really don't have additional information on that option. That was a third-party private firm that was conducting those, and I know that they entered some conversations with officials at the State Department of Health about providing that, and I'm really I'm uncertain about where that went, other than it doesn't seem to have happened, unfortunately.
Okay, you said you're the lone staff and doing the testing. What would it take to get, I mean, is it money-wise, or why are you low on staff? You don't have people available, disqualified, or what's the reason?
We have people now who are out due to COVID, either as a positive case or as a close contact to a case. Just, you know, as cases continue to increase, that's a recurring problem for frontline healthcare workers throughout the country. And it will continue to be a problem. And on top of already having a national shortage of nurses that we, you know, has been chronic and long-standing, and now we're really sort of feeling the implications of that, not just at the health department, but the hospital and other places as well. That they have the beds, but not the staff. And it's a significant problem that's not got a quick fix, unfortunately.
Well, thank you, Doug, again for your report. And as you well know, we have a problem, a big problem.
You're welcome.
Thank you. Turn the floor back over to Mr. Mayor.
Thank you.
Mr. Mayor, I would like to remind our citizens of different places location be tested around town. That is at the Muskogee County Health Department, as Doug stated, Monday through Thursday, 8 to 10:30. You can also be tested at the Urgent Care on South 32nd Street next to Wendy's, Express Wellness on Chandler next to Charlie's Chicken, and MedNow Urgent Care, or MedNow on Shawnee next to Freddy's. That's a location to have right now that also offer the quick test, or tests that can get results within the hour. I would recommend calling and seeing their status. Maybe you may have to make a reservation, you may not, but I would call those locations before showing up there. If there's no other questions for me, that concludes my update.
Councilor Van, I do have a suggestion that you may be able to help with, given your boardship on the foundation. It may not be a bad idea to approach I think it's the Wellness Committee, and ask them if they might consider a grant opportunity for those residents that may not be able to afford to get tested, because even though the health department offers their services Monday through Thursday, to your point, the backlog is going to delay many people from being able to get tested. And so that may be an opportunity. if you'd like to think about approaching it that way in terms of being certain that we can get more people tested at other facilities that don't offer the free service.
I'll reach out to them, Mayor.
Okay.
Thank you.
Mr. Miller?
That concludes our staff report, Mayor.
We have several people signed up to speak to this item. The first gentleman is Pastor Martin. He's on the call. I'm going to ask that you give us your name and address, and you will have 5 minutes.
My name is Gary Martin. I pastor Sanctuary Apostolic Church, 2802 South Cherokee Street. Thank you, Mr. Mayor and Council, for this opportunity. I'm going to try to run through what I have here pretty quickly. Number one, the CDC on October 16, 2020 released a study showing that 85% of the positive cases were from people who said that they wore a mask every day or almost every day or at least most of the time. On March 31st, 2020, the U.S. Surgeon General, Jerome Adams, said that the data doesn't show that wearing masks in public help people during a coronavirus pandemic. Also, on July 2nd, 2020, Maggie Korth interviewed some people from the United Methodist Committee on Relief and also from the National Academies of Sciences, and the release of the information was the same as what I just read to you, that the CDC said and the Surgeon General said that mask wearing does not show that it slows down the COVID. People who still wear masks or who do wear masks still contract it at a high rate. Also, I believe that we need to allow people to choose for themselves if they want to wear one or not. And by passing a mandate to wear a mask, you're telling your constituents that they don't have enough sense to take care of themselves. As for me and my wife and my family, we will not be wearing a mask. It is a religious conviction. It goes against the 9th commandment that bears false witness, because you are telling the people that you're safe from a virus when you're not. You're obeying an unlawful order. The executive branch of a city or of a state does not have the authority to make law. They just enforce law. The legislative branch has not passed the law on masks. The people who are around you feel like that they're safe from the virus if you wear a mask. That's also a false witness. And criminals have been set free from prison and jail all around our country instead of being issued masks, which proves that the leadership of states does not believe that mask wearing is effective. If masks protect us from a virus, why haven't the legislature or Congress and then the state legislatures pass laws to enforce this? And if we follow any unlawful order from a governor, mayor, or city council, then we need to be prepared to follow all future unlawful orders if we agree with it or not. And executive orders do not call the place for millions of residents that live within the cities or the states. They do not have that authority. And we must, to pass a mandate like this, you have to take it to the legislative branch, let them pass a law, and then take it to the voters for it to be voted on, for it to be effective, and for it to be construed as a law. The mask is the precursor to the vaccine. The vaccine is also the precursor to the mark of the beast, and the vaccine will be enforced to track you, and you'll be denied entry into any place of business without a vaccine, and that's the mandate of the mark of the beast. And I'm just going to tell you, the Webster Merriam said that a mandate is a formal order from a superior court or an official to an inferior one. And we, at our church and in my family, I teach that we should not be fearful. Jesus Christ took 39 stripes for our healing and for our deliverance. And I think it bears out that there's 39 different categories of diseases known to man, and Jesus took one stripe for every category. And therefore, I teach my church that wearing a mask is bearing false witness, and my church does not wear them, and my family does not wear them. In fact, I work a public job. I drive a fuel truck, and my job requires the wearing of a mask. And when I gave them my stance on it, they took that away and said I didn't have to wear one because of my religious conviction on this. And passing a mandate like this says that you're taking away the religious freedom that I have to choose on what I want to do and how I want to live. And besides that, a mask mandate can be seen as a power grab by the city council, by the governor, by the legislature, or by the government of the communities. And that's not right either. Also, tests are not an exact science. There are many false positives around the country showing that people are positive when they're not.
Mr. Martin,
in fact, I had a false
I hate to
positive
interrupt you,
test.
Mr. Martin, but your time is up.
Could I intrigue you for or ask for just one more minute?
No, sir. We have several people signed up to speak, and I'm not going to grant extensions to them either. Thank you. The next person signed up to speak to this item is Lynette Gunn. I'm going to ask that you come to the podium and give us your name and your address. You'll have 5 minutes. While she's coming, let me remind the audience we are in session. Please don't boo or jeer or celebrate, rather, any of our participants. Let's give them their time. Ms. Gunn.
Thank you. My name is Lynette Gunn. My address is 220 Bel Air Place here in Muskogee. Mayor Coleman and esteemed city councilors, I come to you with over 25 years of nursing experience in various areas of patient care, and I'm an active member of the Green Country chapter of the Oklahoma Nurses Association. I'm not only coming to you as an advanced practice nurse, I'm coming to you as a wife, a mother, a neighbor, and a citizen of Muskogee. I care about this community and the impact this deadly virus has made in our state and locally. Yes, I have had close friends that have passed from this disease, and I've also had friends and family members that have tested positive. As a nurse working in the hospital, I have seen the impact it's had on the patients and the families of those patients with COVID, the loneliness for being isolated, the actual physical ramifications of having this deadly virus. As my colleagues will come and speak after me, we must not delay in our actions to follow through with this mask mandate. I'm aware that there are many that think that it's unnecessary and that it's a frivolous action, but there are many things that we do, just common everyday things now, that may have been thought as frivolous. Let's talk about the mask itself. If we didn't have a mask and we were getting ready to sneeze, what would we do? We would cover our mouth. Of course, we can't walk around town covering our mouth all day. So this mask is in place of our hand, which prevents the spread of the droplets. Another thing that we do is we wash our hands. What's the first thing you're going to go eat? You're going to go do anything that's significant with your body? You're going to go wash your hands. Why do we do that? Because we're trying to prevent the transmission of this virus. Another thing that we're asked to do is to stand a little bit apart. Why is that? Because we're trying to prevent those droplets from getting on us from person to person. We would think it's strange if a surgeon went into surgery without wearing a mask. And yes, we're not talking about actually doing surgery when we're meeting our fellow man on the street. But the point is that the mask does have a purpose. Seat belts. Would we think not to wear a seat belt now? Now, of course, there are always going to be those that don't follow the rules. But I remember when seat belts was a big issue. And now I would not think of getting into my car without putting on my seat belt and strapping my grandchildren into their car seats. Healthcare is a science as well as an art. The science is social distancing, wearing a mask, utilizing good hand hygiene. These have been proven to help prevent the spread of this virus. The art of healthcare is how we go about encouraging others to adhere to these rules, to adhere to these patterns of health. It can sweep across the community just like the OU-OSU wave at the football game if we all do it together and we do it with the right caring attitude. I am asking you to consider the mandatory mask here in Muskogee. We have tried the no mask way. Let's try the pro-mask way. Everyone will reap the benefits living in a healthy community. Thank you.
Thank you, Ms. Gunn. The next person having signed up to speak to this item is Bonnie Pierce. I'm going to ask that you come to the microphone and give us your name and your address. You'll have 5 minutes.
My name is Bonnie Pierce. I live at 229 Kendall Boulevard here in Muskogee. Thank you for this opportunity. Will all the nurses and the doctor here please raise your hand? We care. We care for the citizens of Muskogee, your constituents. We care with our brains, our hearts, all of our being. We are here to advocate for ourselves and for our neighbors. We are in the midst of the greatest public health crisis of our lifetimes. Current numbers for COVID-19 are City of Muskogee, 398 active cases, an average of 28 new cases per day for the last 2 weeks, well over the threshold for robust containment measures, which is 14.29 new cases per day per 100,000 population. As of Friday, the state testing positivity rate was 14.7% for the last week. 6.9% of patients with infections were hospitalized, and the crude death rate was 1.1%. As of 5 a.m. today, St. Francis in Muskogee has no ICU beds. I'll say that again. No ICU beds. What is your role in this? Let's say you are the pitcher, and the nurses, the doctors, the healthcare system is the catcher. You control what's going on in the community. You control the number of balls you're going to pitch. We catch the balls. The balls you throw and that we catch are the lives of your constituents. The number of incoming balls is overwhelming the system. When that happens, we start dropping balls. We cannot care for patients adequately, and the death rate goes up. In New York, patients died alone in hallways. The virus will kill here just as relentlessly. Watching patients die like that, or while they wait for transport to an open hospital bed, is more than just traumatic. It is horrific and should be a never event for patients' families and staff. We, the nurses of your community, ask that you insist upon some simple actions. I call them the ABCs for COVID control. Always wear a mask. Back off. Back off. Maintain your bubble. Clean your hands. Don't go out if you're sick or if you've been exposed. Everybody has to join in. We're all in this together. Masks work. Oklahoma's data shows that in cities with a mask mandate, there has been a 34% increase in COVID-19 since August the 1st. And in cities without, there has been a 109% increase. That 75% difference is a difference in leadership. That is you. The 75% increase in deaths that goes with that is also on you. The numbers tell the story in lives spared or lives lost. You choose which it will be. Please enact a mask mandate. The data I present are from the Oklahoma State Department of Health and local information from today regarding St. Francis Hospital. Thank you.
Thank you, Ms. Pierce. The next person having signed up to speak to this item is Kristen Price. I'm going to ask that you come to the microphone and give us your name and your address. You will have 5 minutes.
Hello. My name is Kristen Price. My address is 4463 East 123rd
Mr.
Street.
Mayor, you see her mouth?
Oh, I'm
What?
sorry, ma'am. Can you pull your mask up, please?
I'm sorry. I watched one of the city councilors pull hers down to speak, so I thought that was all right.
You also need some tissue over that mic, ma'am.
Ma'am, I apologize for not explaining our protocols to you.
Sorry.
Yes, ma'am.
Okay, do I start with the address again?
No, you're fine.
Okay. We all want there to be fewer cases. That's what everyone wants to do. The question is whether requiring everybody to wear a mask is actually going to achieve that goal. Let's look at some places where that's already been done. Someone mentioned the contrast between cities in Oklahoma. There's so much movement between people in cities in Oklahoma that seems to me to be a difficult place to look to for proof of anything in particular, especially when you're talking about Broken Arrow, Tulsa. It's basically all one city. You might as well say, let's have the people west of Main Street in Muskogee wear a mask versus the people east of Main Street, and then compare the results. I don't feel that to be informative. But I can't lick my fingers. Here's Pennsylvania. There's when they insisted on a mask for everyone, and their cases shot up anyway. Everyone over the age of 2, inside and out, is required to wear a mask in Pennsylvania. Here's New Mexico. Same story. Their mask mandate is so severe that even if you're working out in a gym, you are required to have a mask on while exercising. There is a $100 fine for noncompliance, and it hasn't helped them. They go on and on. There's Oregon. There's when they required a mask for their people, and their cases shot up anyway. Here's North Carolina's doing the same. This goes on and on. There's Vermont. Vermont requires a mask for everyone indoors and out, ages 2 and up. Here's Hawaii. They tried it without being outside, and then they added the outside masks too, and it still went up. And it goes on, and I don't even have time to mention all of them. It's the same in Europe. You'd think, oh, maybe it's, those Americans, they don't follow the rules. Well, maybe in Europe they're better at doing what they're told. Here's Spain. They required masks. Their cases went up. Anyway, it's everywhere you look. It's October and November. They're going through the roof, whether they have a mask mandate or not. There's Germany. If anybody's going to follow the rules, surely it's going to be Germans. But their cases still have gone through the roof in spite of being told everyone has to wear a mask. So if it's not going to work, why are we doing it? This is the Association of American Physicians and Surgeons has compiled a list of many of the scientific studies that have been done. This is 18 pages. I didn't print it all. Cloth masks resulted in significantly higher rates of infection than medical masks. The virus may survive on the surface of the face masks. Self-contamination through repeated use and improper doffing is possible. A contaminated cloth mask may transfer a pathogen from the mask to the bare hands of the wearer. Moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. This is from the Centers for Disease Control, and this is from their very own site. They have people who have reviewed umpteen scientific studies, researched 4 databases for literature in all languages. We aimed to identify randomized controlled trials for laboratory-confirmed influenza outcomes because RCTs provide the highest quality of evidence. Disposable medical masks, also known as surgical masks, are loose-fitting devices that were designed to be worn by medical personnel to protect accidental contamination of patient wounds and to protect the wearer against splashes or sprays of bodily fluids. There is limited evidence for their effectiveness in preventing influenza virus transmission, either when worn by the infected person for source control or when worn by uninfected persons to reduce exposure. Our systematic review found no significant effect of face masks on transmission of laboratory-confirmed influenza. In lower income settings, it is more likely that reusable cloth masks will be used rather than disposable medical masks because of cost and availability. Proper use of face masks is essential because improper use might increase the risk of transmission. I submit to you that it is unfair to the vulnerable population of Muskogee to suggest to them that they're going to be safe if they just put something on their face when they go out. Because we're seeing it's not keeping them safe. People are getting sick anyway. And to lead them to believe that all you have to do is put this on your face and you can go out and you can go shopping even if you have, whatever conditions, it's not fair to them. Thank you.
Thank you.
Oh, I have copies of all of these. Shall I give them to you?
The city attorney will take them.
Okay.
Ma'am.
That was the last person having signed up to speak to this item. Let me say to my colleagues, as well as to those watching, that we don't take our jobs lightly. And it is challenging what we're faced with tonight. But we are at a point where doing nothing is not an option. Nothing is going to cost lives. Nothing is going to cause us more pain down the line. On July 6th, I took an oath that many of my colleagues shared with me. It said that we would support, obey, and defend the Constitution of the United States, the Constitution of the State of Oklahoma, all the laws of the State of Oklahoma, and the charter and ordinances of the City of Muskogee, that we would further swear to faithfully discharge our duties. Tonight is that time. Tonight, it's time to discharge the duties for the people. About 18 months or so ago, one of my brothers was murdered. He was stabbed from behind by a person who had bad intentions, but the right last name. Today, he's walking free. The murderer that we have walking free today is COVID. It is rummaging our schools. It is ravaging our ability to even be civil. It has taken the bandage off of courtesy to the point that people are name calling in the street if you have a mask or don't have a mask. What I'm recommending tonight is that while my brother's murderer is free, we rein in the murderer that we can. I can't bring my brother back. I can't bring back those who've lost their lives to COVID. We don't know what it is. If we did, we wouldn't be having this conversation. I'll agree that the science has changed several times since March, but the death toll still keeps going up. And so to say it's not there will be a disservice to many of our residents. We held up as long as we could, hoping that the other regional partners we had established relationships with will come together to do something regionally. So far, they have not. For some of the reasons that I've mentioned tonight: disgruntledness, disagreement, lack of civility. So I am recommending a form of a mandate. I don't know if it'll pass, but I don't take my oath for granted. And as I said last week, without trying to be smart alecky, I don't do this for votes. This job is free. All 9 of us volunteer, whether we agree with one another or not, to try to make Muskogee a better place. My motion is as follows: that any business located within the corporate limits of the City of Muskogee who invites, permits, or otherwise receives any member of the public into a physical building shall require face coverings be worn by all persons upon entry and while inside of the physical building. Business shall mean any business that sells products and services to a person for his or her off-premises use and shall not include restaurants, given the governor's order today that the state would take care of them. Face coverings shall mean a uniform piece of material that securely covers a person's nose and mouth and remains affixed in place without the use of one's hands and or face shield. Face coverings should fit snugly but comfortably against the side of the face and allow for breathing without restriction. Nothing in this section shall prohibit a business from exempting these requirements for the following persons. Persons who fall into the CDC guidance for those who should not wear face coverings due to medical or mental health conditions or developmental disability. Children under 10. Persons exercising as long as physical distancing is maintained. Persons engaged in indoor competitive sporting activities, whether professional, amateur, or recreational purposes. Occupants in settings where it is not practical or feasible to wear a face covering, such as a dental service, medical treatments, or swimming. Occupants in occupants in personal office or similarly private space with other persons outside of that person's household are not present. Home occupations. Occupants of offices and workplaces that are not generally considered to be open to the public, where physical distancing between employees and other occupants can consistently be maintained during hours of operation. Persons inside any public place or private school building unless required by the school. Persons inside any state, federal, or county building unless required by those respective government agencies. There is no specific penalty or violation for this mandate. However, persons refusing to wear a face covering shall be subject to prosecution under criminal trespass if, after warning, the person refuses to leave, disturbing the peace, disorderly conduct, or other similar offensive as circumstances warrant. It is further resolved that the staff shall continue to monitor the daily infection rate for significant increases in infection and provide the same to City Council. It is further resolved that should the rate of infection reach or exceed the daily equivalent of 100 positive cases per 100,000 residents, let me pause to say that that number is negotiable. In Muskogee County, the City Council shall consider an additional amendment to this resolution, with said amendment mandating the wearing of face coverings for all individuals while inside any place of business, including restaurants, and while at any outdoor location where more than 50 people are gathered. As mitigation strategies change due to increased data and scientific understanding, the City Council may issue further amendments in accordance with guidance issued by the State of Oklahoma or the CDC. Let me state this before I carry my own motion. The mayor of the city of Muskogee does not have executive privilege. It takes a majority of us, in most instances, to have anything passed. People have said, why haven't you done anything sooner? Because it takes 5 of us. It takes 5 of us with our respective opinions and ideals to be able to get anything passed. And I'm asking tonight by way of motion that we approve this request.
Mr. Mayor?
We have another.
You signed up?
But I don't have a sheet. He signed up with the clerk's office.
Sir, did you sign up?
I did at 4 this afternoon. And I'm in support of your...
Come to the microphone and give us your name and address. We apologize that your information did not get to us sooner for you to be able to sign up. We'll do better with our protocols going forward.
Thank you, Mr. Mayor, Council. I appreciate the opportunity. I'm David Kiger. I work at 3332 West Okmulgee. I do live in Fort Gibson. I was raised in Muskogee. I love Muskogee. I'm also a medical doctor. I practiced in Muskogee for about 50 years now, as of next year. And I've got to say that I think my 5 minutes here, I feel like what I have to say is probably the most important 5 minutes in my 50-year medical career. I've got bad news and I've got good news. The bad news, you've already heard it. You've seen the graphs of the caseloads going, curving up, and now it's going straight up. I can tell you folks, that's for real. I can tell you that in the last 10 days, I've had more of my own patients here in Muskogee come down with COVID than the whole 6 months before that. This is like a wildfire. You know, you heard the reports that our hospital system's already strained, our workers are exhausted. If it keeps going up like this, our system's broken, folks. This is a real emergency. But I have good news. Good news is, the truth is, masks do help to cut down the spread. I've got even better news. Not only do masks work, mask mandates work. If you look at those numbers, in the communities in Oklahoma, in the previous 3 months, with mask mandates, sure, the cases are going up, but they're going up at a rate we can probably survive. But in the communities without a mask mandate, they're going up threefold. What happens is if the communities pass a mask mandate. We just got to do this, folks, and we've got to do it now. You know, we can teach people different habits. We've taught people not to smoke in meetings, not to smoke. They've learned it, but over a period of time. They learned it over generations. But we don't have generations of time, people. We need to move, and we need to move now on it. But there's more good news. We're getting vaccines in 4 months. We should be giving vaccines. This will be over. So whatever we do now, it's not a permanent law. You know, not everybody is going to follow a mask mandate. But what we know about mask mandates is they work. I'm a results guy. If it's going to cut down the spread threefold, it's going to be worth doing for a short time. We're not going to arrest and throw people in jail who don't do it, but, you know, everybody has their own freedom. And one final thought. Muskogee has a chance right now to be a leadership community in this regard, because Tulsa has a mask mandate, Jenks has a mask mandate. If we pass one here tonight, right now, I guarantee you, people in Broken Arrow, people in Bixby, people in all the surrounding communities around Tulsa, they'll look at that. That'll raise eyebrows. They're going to say, you know, Tulsa's got it, Jenks has got it, now Muskogee on the other side of it, has it. We better wake up, smell the coffee, and do the right thing. So let's do it. Let's do it now. Thank you. Any
Thank you,
questions
Dr.
for me?
We can't. Well, I guess we can. Do we have any questions for Dr. Kiger?
I do. Dr. Kiger, so I know a lot of people was coming, they said they wore a mask and they still got sick.
Yes.
But as I know, and you've probably also seen, you may get sick, but you don't get near as sick as if you didn't have a mask on and got the same viral load or anything like that. Would you agree to that?
I don't know if that's a fact, but I'm certainly in favor of wearing a mask.
Okay.
Okay. All right. Thank you very much.
Thank you, sir. We have a motion on the floor that may need amendment depending on the 100 per 100,000 or 75 per 100,000. And let me thank Councilors McGee and Dr. Hughes for helping me with the language to that effect on tonight. We'll take questions from the council.
Mr. Mayor, may we recognize?
Yes.
I'm going to kind of refresh your memory just a little bit. 7/20/2020. Special call. Third amended resolution 2807. Failed. Mask mandate. 7/27/2020. Regular mask mandate for wearing on city property. Passed. That means everybody on our city property has to have a mask. And it turned out good. 9/14/2020. Regular, Fifth Amendment, Resolution 2801. Mask mandate failed. 10/19/2020. Special call. Citywide mandate failed. That failed by a 5-4 vote. 4. Let's see. Yeah, it was 5. Yeah, 4 and 4. And then it took one person to pass it, and we wouldn't be here tonight. We'd have that mask mandate in place. Remember, this happened 10/19/2020. Between that time and now, we have went through a lot of sickness and sadness. You know, so 11/09/2020 regular ordinance. 41/11A, adding PD to wear covering. We tried that one. We got police department pulling up to people's cars, going to people's doors, no mask. What citizen, when a police officer pulls them over, is going to say, "Sir, would you put your mask on?" None. Because you know why? Because they're scared, probably. And I don't blame them. I'd be scared too. If that officer come pull me over and he ain't in a good mood that day and I tell him just go put a mask on, he's not going to like it. So we need to set it. We need to set all this time. We need to set an example that we didn't do, because by the police department wearing masks, it's like tonight, those officers back there, I'm proud, they got masks. You know why? They're sitting in city property. But when they get out there in the streets on citizens' property or standing next to each other, they need a mask on. And me and Mr. Miller and Deputy Mayor Reed, we witnessed it over the police station. We were over there, walking through there. They didn't have masks on. And I told Mr. Miller. And Mr. Miller agreed they was wrong. And Mr. Miller went back, I'm pretty sure, and checked them. Agreed, Mr. Miller?
That's correct.
So they were wrong. So another thing happened. 11/09/2020, adding PD, removing fines. You told me on this one. I remember this other meeting said, well, Councilman Van, we just don't have enough teeth in it. You know, we need fees. I mean, we need something. So I brought you back some fees and fines, just like Jinx the other night. No, it was Jinx. They passed a $200 fine, just like I was listening to the lady talk and listening to the gentleman on the phone. Said what they ain't gonna do. We had some people come to council last Monday night. They told us what they wasn't gonna do. So, if what you ain't gonna do, you ain't gonna do. You can't make grown folks do what they ought to do. But it would be good if we did have fines on this, because that's the only way we're gonna get their attention. 11/09/2020, Fifth Amendment Resolution, 2801, Task Force recommendation. They recommended mandatory masks. What we do? We voted no. Failed. 11/09/2020. Fifth Amendment Resolution number 2801. This was your recommendation, Mayor. It failed. And the reason I voted no against it, because it didn't have no teeth. It didn't have no substance to me. I want a city-wide mandate. Not something that's just going to be wadded over and get up and say, we've done something. I want something that sticks. I'm telling you, Mayor, this stuff is real. And I like what you brought to us tonight, but you did not add a city mandatory mask mandate. You did not add the police officers standing at the door. They need masks on in their vehicles. When they drive, I ain't gonna say in the vehicles. When they by themselves, but when they with somebody, they need masks on with the other officer in that vehicle. When they walk up to the cars, they need masks on. When they go to people's houses and have to go in, and sometimes they do, they need masks on. I can understand if they're running, these masks hot, you get tired. They can take them off. But that's one thing in your ordinance, what you brought right here tonight, I just don't think it's enough teeth in it myself, because that's just me. Because I've been after a citywide mandate a long time. And these problems that we going through tonight and all this infection we're going around, it probably would still be going around. But it would be less of it if we'd have had on October the 19th a yes vote from you, sir, to make it Muskogee mandated. That's the problem that I have. But like I said, you got yours on the table tonight, and a lot of people's going to vote on it just because, to say we got something. But I don't want to, I always say up here, don't give me the crumbs, give me some steak. I don't like crumbs. I like steak. I like meat. So we need some teeth in this ordinance, this resolution that you're bringing to tonight. That's just my opinion, sir. No disrespect. That's just Ivory Van. And I'm not trying to disrespect you in no way tonight, but I'm just saying, that's just me. Because these other cities are doing what they're supposed to do. G.T. Bonham's a good mayor. I know him personally. I know the people down in Zapalpa. I know them. But he did say one thing when I was sitting in that hospital room that night. I thought about what the G.T. Bonham said on the news. He said, we have all these people that around our city, Jinx, Broken Arrow, oh, that's another one. They don't believe in mask mandate. We got all these people coming in to our city, going to St. Francis, Hillcrest, filling up our hospitals. Saturday night, that was a true statement. I witnessed it. And I thank all the healthcare workers that come tonight to let us know how you felt. I appreciate y'all for all the hard work that you do, because I know it's a job. I watched Muskogee Regional Medical Center nurses the other night and their doctors. So I want to appreciate for everything that y'all do. And I hope tonight we can get a citywide mask mandate to protect our citizens, because that's what it's about, is protection. I brought a coffin here last Monday night. People made fun of it. That's okay. But if you don't, some people, coronavirus affects us different ways. But sometimes when you land in front of that coffin, the reason I bought it, I wasn't trying to bring it as a scare tactic to anybody. I was just bringing it as a prop to prove a point. That coronavirus, that's the last stop right there. Was when I brought that coffin up here and people had to lay in it. So I wasn't trying to be funny. So I just want something that has some substance, and I want a citywide mandate, not something dry watered and just watered down. I want something that's real. I'll turn the floor back over to you, Mr. Mayor.
For the benefit of those others who may have been suffering from other types of memory lapses, for you to know the facts as was presented, this mask mandate is not for Houston or Atlanta or Texas. It is for the city of Muskogee. It applies to every business in the city of Muskogee. It applies to every resident when they try to enter into a business inside the city of Muskogee. It applies to any place where people will congregate inside of a building inside the city of Muskogee. And so I appreciate everyone's comments. My job is to build the bridge that the gulf of dissension has been created with using coronavirus. It has divided us severely, and we will get there one step at a time. Do we have any further discussion or correction to the motion from Dr. Hughes or Dr. McGee concerning the number per 100,000?
I'd like to move to change it to 75 per 100.
75. Mr. Tucker, does it need to be read again, or can we just take that as amended?
We would take that as amended, which is actually the fifth amended resolution, 2801.
I'm in my motion. Do we have a second?
Yes, I just wanted to ask one question on that. Just based upon our numbers, I think Ms. Pierce had brought to us, what is, as I look at the report that he gave us there on November the 16th, 398, it's only one time that we've been at over 75%, correct, as far as active cases?
As the county, we're at 79% per 100,000. As a city, we're a big bulk of that, about 60% per 100,000. Okay. Before that, we were 26, 26, 26, and then it was 14, 11, so it went down that way.
I'm just looking at the number 75 being attainable. That if it gets worse, then we can activate that part of the solution here, the resolution.
Well, if it was passed the way it's written, 75 per 100,000, it would be enacted written per this.
Okay.
Is that correct?
Is that correct, Roy?
Based on what the motion was, yes. Okay. And that's daily. I know some of the statistics are weekly.
Mm-hmm.
Can I ask a quick question?
Yes.
What do you have against a a real citywide mandate as a mayor?
I don't know what your definition of real is, because this is as real as it can get.
No, I can get much better than this, Mayor, but you just missed my point again. When I told you about, this don't have anything to do with the police officers back there in the back. This, Mayor, this doesn't say anything about them having a mask when they come up to your car or go into your homes. Now, if it does, excuse me, I'm wrong, and I'll agree. But I think that needs to be added to it in this, what you're proposing. That needs to be added to it. Those officers' face need to be protected when they're around our citizens, when they go to their homes. I'm lowering my voice as nice and calm as I can, okay?
You're welcome to yell again if you like.
Oh, no, I'm not yelling. I'm just stating the fact. I don't see that in your proposal here. Because I know if they come to pick me up and cuff me, I want them with a mask on, for my protection. And I don't see that this is in your resolution here. Is this a resolution? It's not ordinance, right?
It's an amendment to the policy.
Amendment to the policy. Well, I don't see this in the amendment to the policy.
It's not there.
It's not there, but I think it should be there.
And if I'm not mistaken, Mr. Tucker, we have policy governing that interaction already.
It is referenced in an earlier rendition of this resolution, which...
No, I mean, we have an internal policy.
Right, which is referenced.
Yes.
In this resolution as well. It was, as of July 27th, the city manager is directed to establish and enforce a policy for the wearing of face coverings for employees of all city-owned and operated facilities. And that was, I believe, in the third or fourth amendment to Resolution 2801. But regardless, it, as of the 27th of July, has been part of the resolution.
That being said, if that is already a part of the existing resolution and it's not happening the way it should, we have an opportunity to work with Mr. Miller to be certain that that is done, since it's his job to direct staff.
Certainly.
Let me ask this, Roy. Right now, if we pass this, because, like I said, I remember when they came up here, the chief was talking about, he was saying that his officers didn't have to wear masks. They just wanted the citizens to ask him to put masks on. So we need to get this very, very clear tonight, that officers are included in this also, to have masks on when they go to people's homes, when they go to people's cars, when they're sitting at talking to each other, come and go. Like I'm go out there and talk to you real close. I think all that needs to be in this to make this for what I need it for. Because we all, as you say, Mayor, everyone, we're working together up here trying to protect our citizens. And that's all I'm doing, is trying to protect our citizens. So I think that ought to be placed in there to make sure. Because I know when I see them, when I'm driving around town, I drive around all town all the time, they're standing to each other just talking, nothing, no face covering, no mask,
Well, the resolution that was offered doesn't address the issues of city employees. It only addresses the inside of building, members of the public who go inside of a building of a business. That section that we talked about earlier directed the manager to create a policy. And so that's all this ordinance relates to is, not this ordinance, this resolution to direct the manager to prepare a policy, which already occurred. And so what's being offered as the Fifth Amendment doesn't address that at all.
Well, I think what we need to do is to address that.
Can we call for a motion?
See, there you go, Mr. Reynolds. You've cut me off. I don't cut you off when you're talking, sir. Do I? I'll be respectful to you, and I expect you to be respectful to me, sir. And I'm just trying to get something straight here. That's very important to me, as a councilman, and as a citizen. We're trying to protect the health of everyone. Businesses, restaurants, you agree, Mayor? That's what we're doing. We're trying to protect the health of all our constituents. Correct?
I'm going to let you finish, Councilor Van.
But that's all I'm doing. I just want something like that in this, what you're proposing, before I say yes. Because we need it all included. I want it citywide. And what you've done here is good. It's a start. But we don't need a start. We need to jump. We need to jump over the hurdle to get it done. That's just me. But I would love for you to see if we could put that in there tonight, as far as officers are concerned. Same thing with firemen. They need to be, when they're out, they need masks on. All our city employees. When they were out in the garbage truck, those guys, I've seen them, they all got masks on, riding with each other. So they're protecting themselves too from each other. So if we're going to do one, let's do it all for all. We've done a great job on getting masks up here in the city council chambers that we had a real hard time at first getting them up in here. But everybody in here has a mask on. Why we used to have to try to get masks in here, but we got them in here now. So that's just what I like to see, Mayor. I ain't trying to give you no hard time or anybody a hard time. I am so for a mask mandate. I am. I'll turn the floor back over to you, sir.
Thank you, Mr. Van. As previously stated by Mr. Tucker, that item is already in a previous amendment. We will be visiting with Mr. Miller to be certain that it is correctly carried out. We have a motion on the floor.
Second.
We have a motion and a second. Further discussion from the council. Roll call.
Tracy Hoos,
Yes.
Tracy McGee,
Yes.
Stephanie Morgan,
No.
Alex Reynolds,
No.
Jamie Stout,
No.
Ivory Van,
No.
Mayor Marlon Coleman.
Yes.
We have 4 noes.
The item fails. We are adjourned.